There are various triggers for migraine headaches. These triggers include your genes, it could be environmental factors, it could be lack of sleep, it could be too much of sleep. Also, diet plays a huge role to trigger migrainous headaches. Diet such as a high carbohydrate diet, colas, cheese, chocolates, pastas, pizzas, all of these can actually trigger migraine headaches. It is very important to identify the headache because not all headaches are serious, but you also need to realize that some headaches can be serious and they need to be treated appropriately. In fact, secondary causes of headaches can include traumas, tumors, infections, or inflammation. So how do you identify the secondary headaches is very important. You need to go to your doctor and your doctor will evaluate you for these. But in general, you need to identify the red flags for headaches. So if you have intractable vomiting, if you have fever associated with your headaches, if you have blurring of vision or like double vision associated with your headaches, or if you have other signs like weakness of your hands, weakness of your legs, other issues like seizures, etc., you need to immediately seek medical help. Because when you are seen by a neurologist, he would advise certain investigations. For example, he may advise blood investigations, or he may advise an MRI scan or a CT scan, which will help you to diagnose secondary causes of headache. Once the diagnosis of headache is appropriately made, then you can treat the headaches appropriately. Also remember one thing, painkillers are not a solution to treat your headache. You need to appropriately treat your headaches. For example, for migraine, your doctor may prescribe certain medications which may be for about 3 to 6 months, which will help to actually treat the headaches appropriately. So in general, I would like to summarize that headaches are a treatable disorder. It is important to identify what is the kind of headache that somebody has. And also it is also important to identify whether it's a primary headache. So primary headaches in general are migraines. The other kinds of primary headaches are cluster headaches, tension type headaches, etc. Remember one thing, sinus headaches are not so common. It is often misunderstood that the most common cause of headaches are sinus headaches. Sinus headaches are usually associated with inflammation of your sinuses. They may also be associated with fever, and it is actually a secondary cause of headache. And you need to go to your doctor and appropriately treat these headaches. The advice that I would give you is that do not self-medicate your headaches. Seek adequate attention for your headaches. And also you need to make appropriate lifestyle changes in order to have good remission of your headaches.